Let us go to diagnosis according to Zhangfu organ patterns. The topic is Heart Qi Deficiency. Heart Qi Deficiency. This pattern has symptoms and signs that are specific to the heart, such as palpitations, whilst also manifesting general Qi deficiency symptoms and signs, such as fatigue. This pattern can be physical or mental emotional, with a person lacking self-esteem, self-confidence, or happiness. There is a close relationship between the heart and lung in their functioning. This means that there will usually be tangible symptoms and signs of lung Qi deficiency where there is heart Qi deficiency. Heart Qi will also be weakened by prolonged or excessive sorrow and melancholy, which also affects the lung negatively because even though these emotions affect the lung directly, Shen and thereby the heart will register and be conscious of these emotions and thereby also be affected by them. When a person experiences sorrow and melancholy, there is also a lack of joy. This means that the heart Qi will lack nourishment. Heart Qi in general is nourished by joy and love. A person whose life lacks joy, love, and a sense of companionship and belonging will often become heart Qi deficient. This can particularly be the case if the person did not experience enough love and attention or if they felt ostracized in childhood. In childhood, the organs are not fully stable and their Qi is more volatile. This means that the internal organs can be easily affected by etiological factors such as the 7 emotions. These factors will have a greater effect in childhood than they will in later life and can permanently influence the organ in question. So let us look at its etiology. Blood loss, prolonged illness, physical strain, and emotional imbalances. A lack of joy in life or loneliness can particularly lead to heart Qi deficiency. Shock scatters heart Qi and thereby weakening it. The heart controls sweating. Excessive sweating can deplete heart Qi. The consumption of recreational drugs and some medicines can open the heart and thereby spread heart Qi. This can weaken heart Qi deficiency over time. The symptoms and signs are palpitations, slight shortness of breath, shallow breathing, pale complexion, mental, physical, and or emotional fatigue, spontaneous sweating, sadness, melancholy, lack of joy, feeling of loneliness, depression, low self-esteem or lack of self-confidence. The person may seem very quiet, diffident, or shy. Speech impediments such as stammering. The voice may sound flat and lack vitality or tone variation. Lack of sparkle in the eyes. Pale or normal colored tongue. Deep and weak, especially in the left chin position. The pulse may be knotted. The key symptoms are palpitations, fatigue, sadness, lack of self-confidence, and a weak pulse. The treatment principle is to tonify the heart Qi. The acupuncture points to be used are Heart 5, Heart 7, UB15, REN 6, REN 14, REN 15, REN 17, and Stomach 36. The needling technique is tonifying and moxa can be used. The explanation for the points is that Heart 5, Heart 7, REN 14, REN 15, and UB15 tonify heart Qi. REN 17 tonifies Qi in the upper jaw, and REN 6 and Stomach 36 tonify Qi. For relevant advice, heart Qi is best tonified on the emotional level. It is important that the person cultivates joy in their life. Of course, this is easier said than done. As well as working with their emotions, the person can try to spend some time each day doing something that gives them genuine pleasure, or they can sit and meditate on something that for them is beautiful. Tonifying Qi in general will also benefit the patient. This can be done through the diet, access to fresh air, and breathing exercises, as well as getting enough rest and avoiding overexertion. Heart Qi can be depleted through excessive sweating. This means that the use of saunas and steam baths is not something that is recommended for these patients. The patient should avoid the use of recreational drugs, medicines, and experiences that spread heart Qi. Heart Qi deficiency can be caused by the following patterns of imbalance, like spleen Qi deficiency, lung Qi deficiency, kidney Qi deficiency, gallbladder Qi deficiency, heart Qi stagnation, and blood deficiency. And these are the following patterns of imbalance is heart yang deficiency, heart qi stagnation, heart yin deficiency, heart blood deficiency, and lung qi deficiency. So, as a summary for heart qi deficiency, the etiology is sadness and grief, chronic illness, blood loss, insufficient ancestral qi. The underlying or accompanying pathology is spleen qi deficiency, heart and or liver blood deficiency, kidney qi yang deficiency, wind cold settling in the heart, and static blood obstructing the vessels. The possible presenting conditions are cardiac failure, angina pectoris, arrhythmia, general asthenia, and neurosis. The signs and symptoms are palpitations, shortness of breath, worse on exertion, and oppression in the chest, sweating, pallor, tiredness, and fatigue. The pulse will be empty and the tongue will be normal or pale color and may have a midline crack reaching to the tip. The treatment principle is to boost heart qi and calm the shen. The acupuncture treatment is heart 5 to supplement heart qi, bladder 15, the back shu point for the heart, ren 6 it supplements original qi, heart 7 quiets the heart and spirit. Pericardium 6 supplements heart qi and calms the shen. Ren 17 is a gathering point for qi. Ren 14 clears the heart and stabilizes the spirit. And stomach 36 regulates qi. Needle with supplementation and moxa. Thank you so much for your attention.